Well, usually I do the second treatment in the same session. It is a strengthening one, in the point where you should devote more time after the analysis that is always done after the informed consent. So in this case, there's a greater concentration of the damage in the introits or in the periurethral area. So it is better to stop more on this area. If you have an incontinence problem, you should treat more the anterior part, trying to stay in the area. But well, it depends on the symptomatology that the patient refers. There's another question at the back.
English because I'm Portuguese, but unfortunately my Italian is no good.
Okay.
So
I hope my English is better. I don't know.
My name is Teresa Fraga, and I've been doing laser CO2 for treatment of the genital urinary syndrome of postmenopause.
Yes.
The Mona Lisa touch with the DECA laser. 5 years now, 5 years from now, with very good results. What I'm asking is if there is any comparison study with the results with CO2 laser and this FamiLift.
A comparison study between other laser?
Yeah, now between laser CO2. Microablative fraction. It is a technique that has been described by an Italian, Stefano Salvatore.
Yes.
And the histological studies have been proved here in Milano by Professor Alberto Caligaro in the University San Raffaele, I think.
Yes.
2014.
Yes.
I think it may.
But the question, what? Can you repeat the question exactly?
If there are any comparative studies, what's the improvement between laser CO2 and this laser?
La dottoressa chiede se ci sono degli studi comparativi rispetto a questo laser rispetto al laser a CO2.
No. It's not to perform these studies because normally people that used in the past CO2 laser nowadays is not sufficiently so habit to use this laser again.
Può parlare italiano perché io ho capito, io non parlo.
Allora dicevo.
So this kind of laser CO2 is being abandoned partly because of its ablative effect. So there was a warning by the FDA, so it's harmful and painful. The patient doesn't like to undergo this aesthetic, I would say, or rejuvenating treatment, which is painful. So one thing is using an aesthetic for an external treatment, like Thomas showed, but internal in the vagina, the treatment with this laser is preferable. Even Salvatore changed to the YAG and others to this non-ablative laser, which is solid-state diodes. But at the moment there are no comparative studies. We have carried out studies using this laser versus follow-ups or patients treated or untreated. At the moment the study is only on 100 patients done assessing the effects of lasers, both asymptomatic with markers and at the anatomopathological level.
Any requisites? Do you ask some examine some cytology, some
yes, of course.
HPV tests?
Yes, yes, of course. We perform examination to avoid vaginosis, bacterial vaginosis, or to avoid cystitis. In that case, laser is contraindicated, and you take care before to treat this vaginosis, bacterial or cystitis before treat the laser.
Okay, thank you.